We're very fortunate to have today our speaker, Dr. Thomas Gillespie, a professor of surgery, an assistant dean for medical education at Creighton University School of Medicine, based out of your very own Phoenix. He is one of our leaders in the medical education space here, overseeing, I think you own the fourth year and a lot of the third year and several other aspects. I think he can't see me, I'm smiling, right? But obviously an expert in medical education, hence his participation today. But in addition to that, his clinical expertise as a surgeon is in addressing abdominal wall issues, and very specifically expertise in hernia repairs and hernia issues. So without further ado, I present to you Dr. Tom Gillespie, who's going to present on leaning into Gen Z, rejecting safetyism. Dr. Gillespie?
Well, thank you. I just found out Tammy, this is retiring a week from today. Is that right, Tammy? I've known Tammy for 22 years, and she's also been a leader in education. And I just want to tell you heartfully, Tammy, I appreciated our friendship and our journey together. Today we're going to be talking just kind of about, I call this leaning into Gen Z, rejecting the safetyism, but what I really want to talk about is the contemporary learner and how we navigate generational shifts. And these occur every 20 years or so. And sometimes they come on quicker than we realize, and what we can learn from this. And now my slideshow is not working. Good. Well, no. Okay, so one of the themes that I want to bring out, this is kind of a little bit of a reflection, is what we really hope to establish here at Creighton, among all the training programs and education programs, is this thing called a culture of learning. And what I love about the culture of learning, and I'm just going to highlight a few things, is one, it really is focused on curiosity. How can we develop curiosity in the learner? And number two, that each one of us are committed to our own personal and professional growth. This is not something that's given to us. This is something we have to do. And therefore, we have to take responsibility ourselves for our own development. And what's important is everyone is on that journey. Whether they're a third-year medical student, or they've been an intern for a month, or they've been a chief resident for a month, or they're a brand new faculty member, or they're someone in a leadership position, they're all in the same space. And so how can we promote that for everyone? Not just how can the people on top promote learning in younger people, but how can all of us go through this journey together and feel responsible for each other like we are a community? And I think that that's really important. And so what I want to talk about first is this is actually seen kind of in the workplace. And what we know is that the best place we would ever want to work has high accountability and high psychological safety. And what we've learned is that if you have low accountability, but everything is nice and safe, you're going to feel apathetic. You're not going to have that drive for curiosity and learning. On the other hand, if there's high accountability, but no psychologically safety, that would be a chronically anxious organization that doesn't have a lot of resilience. So all of us remember being in medical school. We all, as faculty, remember being residents, and we all pride ourselves in creating psychological safety. But what if we do that without accountability? Or what if we have so much psychological safety that in the attempt to protect our learners, we create something on accident called safetyism? I don't know if you've ever heard of this concept, but it's kind of a newer concept. And safetyism, by creating high psychological safety and low accountability, can deprive young learners of the experiences that their anti-fragile minds need. And it makes them more fragile, more anxious, and more prone to seeing themselves as victims. So sometimes we can create an environment that's so safe, it backfires on us. And we see it and we get frustrated as we're trying to teach. And so as we go through this, I want you to think about like these kind of dualistic things that can occur, that while we're trying to cultivate learning, are we actually coddling our learners? And as we're trying to form people into physicians, at the same time, maybe they're bringing in something that feels a little transactional. Like, I have to get out of medical school to get my residency. I've got to get out of my residency to get my fellowship. I got to get out of my fellowship to get my job, right? And when we're transactional, sometimes we're not actually forming, we're just getting through. Kind of like using AI to write a paper. You wrote your paper, but what did you learn, right? And so what is a generation? I like this. I asked AI to generate this for me. But when we talk about a generation, it's really a cohort of people in time and space that have shared cultural experiences. So like we could say Gen Z maybe experienced COVID, and that's a shared cultural experience. And when we think about medical school, each of the generations experienced medical school differently. You know, I'm Gen X, textbooks. I didn't have email in medical school. Gen X did not have email in medical school, okay? Whereas each of the generations experienced learning differently. Okay, so what is Gen Z? We're going to talk about them today. Really, they're born between 1997 and 2012. That means they're between 12 and 27 years of age, which means it expands from the first year of junior high all the way to third year graduating residents. Okay, so we're in it. The workplace in medicine hasn't seen it yet, but residency has a lot of people who are Gen Z. And what I want to do is, this is not a disparaging conversation about Gen Z. This is what is Gen Z. So this is a band called The Who. I'll just play the song for you real quickly. So what's important about this is, when I played this in front of a whole bunch of adults, they laughed, they smiled, and they were full of joy. This is Pete Townsend of The Who. He's a boomer, right? The boomers, they were the generation of Woodstock, free love, feminism, which was described as bra burning, right? And Pete Townsend, who is now in his 70s, said, I would rather die than get old. And they asked him this. They said, okay, you're old now. Do you wish you were dead rather than becoming the old people that you were criticizing? He's like, well, no, I kind of meant it figuratively. But in reality, no generation has ever entered the workforce without feeling like they're the outsider. And so the boomers now, who we kind of disparage and call boomer, were actually the people pushing back in the 60s. So what is Gen Z in a nutshell? I think all of us know kind of what it is. I was talking to one of my chief residents, and she literally had 5 screens open at the same time. She was watching a video of surgery. She had her email up, she had her iPad up, and she had the medical record up, and she was texting people. That is Gen Z in a nutshell. And what's really important about Gen Z is they have a very hard work ethic. And I can see it. I can see it in my daughter. I can see how much work and effort they put into every day, but maybe they haven't really had a job before. They use multiple communication channels. Medical education is extremely expensive. Creighton, $80,000 a year for tuition. So in a way, if you think about it, no one has invested more to become a doctor than the generation of people sitting in front of me. But a lot of them struggle with mental health issues, and they want their education personalized. So let's not talk about us. Let's talk about people who have graduated college or high school and are entering the workforce. Right now, high school grads have 3 times the unemployment rate as the rest of America. And when high school students go out into the workforce, they're not prepared. They're just not prepared to show up on time, punch a card, work, and be told what to do. And managers are very reluctant to hire Gen Z right now. And many college grads, despite their degrees, they're not working to their degree, to their education level. Okay. And unfortunately, bosses are firing Gen Z after hiring them very, very quickly. They're losing their job within 3 to 6 months. And many companies don't even want to hire Gen Z. So if we look at the data, Gen Z in the workforce, right? If you graduated college and not in medical school, you're in the workforce. If you graduated medical school and didn't become a resident, you're in the workforce. Right now, companies want to cut the number of Gen Zs in the workforce. And what we have that are actually in the workforce. Why they're struggling, they're not going to say they're lazy and they don't know how to work. They're just going to say that the managers are dodging them. They're not giving them the feedback. They're not training them up. When they get into the job space, nobody's telling them what to do, and they're used to people telling them what to do. What's very interesting is they even enter a job not with the trajectory that other people, like, I'm here and I want to ascend in the workforce. This is just not normal or not typical for people, because typically when people choose a job, they want to climb. And what they've noticed is that managers are actually burned out trying to get them up to speed. And so that they're quitting before they actually get fired. It's just easier to quit than to get fired. And that they really don't understand how to interact with people, because a lot of the workforce now is hybrid, where you're 2 days at home, 3 days at work. Okay. So really,
I got away with everything under the last boss, and it wasn't good for me at all. So I want guidance. I want leadership. But don't just like boss me around, you know? Like, lead me. Lead me when I'm in the mood to be led.
and this is just something that we have to figure out, right? So I really want to look like this is a continuum. That there's early career when there's early criticism when a generation enters the workforce. I totally remember when the millennials entered the workforce, and we were talking about them. Well, now they're actually the bosses, and now Gen Z is working is entering the workforce. So now there has to be, how do we overcome these doubts? How do we build resilience in the workforce? How do we get people to gain experience, develop the skills, and ultimately thrive in the workspace and become the leaders for the next generation? And so I want to make it very clear, Gen Z is not the first generation to enter the workforce that people didn't understand. Remember when the baby boomers, hope I die before I get old, I went to Woodstock and college, now I'm entering the workforce. It's the silent generation is telling them, guess what? Rigid roles and expectation, right? You have to sacrifice your personal growth for job security. And they did it. They did it. They did it from 20 to 50. And then they woke up one day and they had a midlife crisis because they put their entire self into their job and it wasn't meaningful for them. Okay. And what did they do? They became dependable workforce. And what they did is they just built skills by staying in the same job for 20 years, the gold watch, we all heard it, right? And then that got pushed back from Gen X, right? Gen X, they were the latchkey children, right? They were the kids who get on your bike, come home before the lights turn on, take care of yourself. They were the latchkey kid. We started seeing divorces, right? The kids who were at school, they would wear a key around their neck. And so the teachers would say, okay, you get to walk home. You're not getting picked up. They would walk home, unlock the door, make themselves a sandwich, watch TV, get their homework done. And then mom came home, or dad, most likely mom, and maybe dinner was ready by the kid. And that's what a latchkey kid was. And what happened is when they entered the workforce, they said, what about work-life balance? Don't I get to have a life and a job? And so they became resourceful. They became latchkey employees. And what that meant was when they came to work, they didn't want to be told what to do. They didn't want to be told when their lunch hour was. They didn't want to be told what the expectation was. They would just go do it on their own. Okay. And then they brought into the workforce the whole idea of flexibility, family leave, and they were the ones who brought in the conversation, work-life balance. Well, guess what? The millennials then came into the workforce, right? And what did they want? They wanted meaning from day one. They wanted to be hired into a meaningful job. And so what we called that was a quarter life crisis. Because if the boomers were having a midlife crisis at 50, the millennials were having a midlife crisis at 25. Why do I show up and I don't feel like my life is meaningful? But what they did is they turned to continuous learning, skill building, and they built what's called the gig economy, how they could have 3 jobs, work from home half the time, and create a meaningful life. And so there was a lot of change and they got a lot of pushback. And so Gen Z is the same thing is happening with them. Okay. So now let's transition from the workspace into the modern industrial educational complex. Now remember, education was built to put people into the workforce. And so if you think about it, your education has been like a factory. You've had batch dates. You're supposed to develop in all skills at the time. You're given a graduation, bells ring, they tell you where to be, yada, yada, yada. And you're measured. You're measured by SAT scores, MCAT scores, standardized tests, so we can say exactly what the quality of the person is. And that puts them into the next level of education. Not very good, but it's real, right? So now what happened is that we have produced academically proficient, but developmentally delayed graduates, okay? And they value efficiency in education. How can I get this work done as quickly as possible so I can get to the next thing I have to do? Education became transactional with great inflation, CV building, right? So we created a generation of people who know how to build a CV. At the same time, they want to be agents of change. They have a very strong work ethic. How do you know? Look at their CV, look at all the things they did. But despite these achievements, they weren't fully formed into adults as they entered the workspace or now advanced education space. So what is the challenge for us at Creighton, right? Cura personalis, that we have to see the whole person. Gen Z is a whole person. So what do we need to do? We need to learn how to navigate the generational shifts in medical education while at the same time upholding our formational values, right? Formational values is forming people into the doctors they will become 20 and 30 years later. That is so much more important than being a great medical student or being a great intern. What we're trying to do is create the doctors that are going to care for us in the future. So how do we do this? Well, I love this. This was actually said to me from a medical student. We stop asking, why are you this way? What we're asking now is what happened to you? Why are you this way? And I think that's different. And so what I did is I moved into these 3 books, and these are great books and they're great things to listen to, especially if you're a parent. The Anxious Generation, how the great rewiring of childhood is causing an epidemic of mental illness, how good intentions and bad ideas are setting up a generation for failure, why today's super kids are growing up less rebellious, more tolerant. That's a good thing, right? But less happy and completely unprepared for childhood or adulthood. Okay, so let's ask a question. What happened? What happened? First, We tried to create a very safe world for kids. That is a good thing. When I grew up, we didn't have safety belts. People smoked on airplanes, right? You would go to the movie theater and they would have a smoking section. When you stood in line at the bank, they would have ashtrays, right? And so what we did is we created a world where the death rate for children went down, that injuries for children went down, that kids weren't dying in motor vehicles. Kids aren't killing themselves the way they used to, like violence in the street. We're vaccinating our kids to make them healthier. We're getting rid of diseases that would decimate communities. And we've created regulations, safety standards, and we've advanced medical technology. So it's never been physically safer to be a kid in America than it is today. That's a good thing, right? And what else did we want to do? We didn't want our kids drinking and driving. Guess what? Alcohol use is down. Binge drinking is down. Illicit drug use in high school is down. These are all great. Cigarette smoking is down. Vaping went up for a minute. It's down. Kids know it's dangerous, okay? And teen birth rates are down. These are all good things, right? And it's not just that children are getting abortions when they're getting pregnant. They're just not getting pregnant in high school anymore. And even like early sexual intercourse at an age where they're not adult enough to understand what the consequences are, even that is down. We've done good, right? But guess what's happened? We're seeing some delays in milestones. 16-year-olds aren't like on 16-year-old in day one, I'm going to get my car and just drive out of this city. They're not driving. They're not working. They're not dating like they used to be. We know that kids are moving in with their folks or not even leaving the house to go to college. They're getting married later. They're having children later. And I love this analogy. Go back to the late 60s, early 70s. The average age of the combat soldier in Vietnam was 19. So that means when their tour of duty was over, they're 21, 22, they're getting married, buying a house, getting, a loan, a VA loan, or getting an education loan, going to college, paying bills, and they're living like adults at 25 or 26, married, one kid. And I'm not saying it's better or worse, but take a 25-year-old now and compare him to someone who was in war, married with children, with a loan and a job. That's pretty just different in very short order. And so what we've seen now is that there's been a change of the social and emotional and value-based development, and we've been measuring this for years. So first and foremost, even though there's TikTok and Instagram and all the ways that kids express themselves, they actually feel that they're held back from self-expression. Okay, that even though they can use the words to describe emotional intelligence, if you actually test them for emotional intelligence, they do way worse than previous generations. Even though they know the words, they don't know how to actually apply them and use them in real time. They have higher depression, anxiety, suicidal ideation. And here's what's interesting. When you look at what's most important to a generation, if you go to the boomers and follow that through, family, community, marriage, and children used to be the number one goals. Now it's happiness. 65% of Gen Z says they're motivated by what will make them happy. Happiness is a fleeting emotion. It's not meaning, it's not joy, it's not community, it's not bad. It's just that family has been replaced with happiness. And what we've learned about their moral development, that's changed too. They define their morality as changeable, meaning that their morality is based on situations and is relational, is relative. They have relative morality based on what they hear and see. And so they're more focused on evidence-based things than they actually are just being part of a community that's focused on God. And I'm not saying that's better or worse, but there's less faith in Gen Z, which is just different. So what's happened in schools is the coddling campus we've somehow gotten physical safety confused with emotional safety, and we're extending the emphasis on physical safety into the psychological realm. And this is what created safetyism, that thing I talked about at the beginning. And so what we're creating is a generation, or the generation has been created such that the physical, the discomfort from physical harm is being transferred into the psychological space. And they want to be protected from uncomfortable ideas and experience which actually feels like harm. If you say something that makes me uncomfortable, I perceive that as violence or harm. I feel uncomfortable. That's bad. Okay, that's new. And so what happens is students, think of your medical students, they may seek environments that are free from difficulty and emotional discomfort, avoidance. And this can hinder their development of resilience and critical thinking, and it definitely hinders their personal growth, okay? And we see it. Here's the data from surgery. 85% of general surgery graduates are now pursuing fellowship. Why? Why? Because they don't feel comfortable and confident. Okay, and this is not a phenomenon of work hour issues. They feel unprepared for independent practice. And when we measure them, they're graduating from residency, they're in a fellowship, their fellowship director says, start the case. I'll be in there in 45 minutes. They can't. They can't actually operate for 30 minutes alone. They feel a lack of autonomy. Now you can say they're not given autonomy, but if they're fearful of uncomfortable feelings, maybe they're not leaning into autonomy. And so what's happened is this is actually going to project into, we will have a cities full of specialists, but we may not actually have general surgeons who actually feel comfortable, and that will affect rural healthcare way worse than it'll affect a major city like Phoenix, okay? So what is going on? There's an expectation on all of you as educators to the medical students that they kind of want you to take on a parent role. They want you to be that parent that protected them from feeling uncomfortable, right? And they want the same level of safety and protection that they got in high school and college from their parents, from their coach. They want you, the residents, to give that to them. And what you may notice is that they're going to avoid things that are uncomfortable. They're going to avoid things that are challenging. And they're going to be reluctant to even get into a disagreement with you. Like, remember the old days where people would push back? They're afraid to do that. And so what happens is that the more ambiguous the situation, the more lack of clarity, which medicine is full of, they want you to tell them what to do. They want you to be the parent so that they don't have to think. Think about a third year medical school presenting, oh, they can report. But when you say to them, what do you think is going on and what should we do? They want you to tell them. And can we see the change? Okay. Now think about this. The students want us to be parents to them, but parents are going through burnout. Right now, the U.S. Surgeon General, what is this, 2024, says that being a parent is a mental health issue. And so now our students are expecting us to be a parent. Maybe we're getting frustrated with them, okay? Maybe we're getting frustrated with them. That's going to make them avoid us more. We've created a cycle where we're not educating the next generation. Okay, so let's break this down. Psychological safety, good. Safetyism, bad. Psychological safety encourages open dialogue, risk-taking, learning from mistakes. Safetyism protects people from mistakes, and that makes them avoid the discomfort of mistakes. We learn from our mistakes. Safetyism reduces students' willingness to engage beyond their comfort level and be challenged in ways that may make them not feel good about themselves. And it hinders their growth. And what's important about this is the face-to-face communication, right? They have anxiety talking face-to-face with us. And this gets in the way of their interpersonal development. And remember, we need to train them to be interpersonal because we understand that once you learn the medicine's easy. Being a doctor's hard. So what's really important is no matter the fact that we have a generation of developmentally delayed learners, we haven't changed the expectations of the specialty. Medical school's not longer. Nobody wants to be in residency longer, okay? But we still have to get them there. And what's even probably more difficult, if you think about it, is there's more to learn than when I had to learn, right? Right now, I have to teach my residents how to do a hernia 3 ways: robotic, laparoscopic, and open. When I trained, I only had to learn it 1 way. So in this world of developmentally delayed students, they have to learn more than we ever had to learn, and we never lowered the bar. The bar is still the same. When you graduate in 4 years, you're going to be an MD, makes decisions, or you're going to graduate with your DO degree, do operations, and nothing has lowered. Pushback. Am I right or wrong? Come on, get uncomfortable. Nobody wants to speak up, right? Show me that I'm wrong. Somebody say something. Okay. Anybody at Valleywise? You gonna say something? Yeah, please.
Yeah, I think with the choosing fellowship for like surgery, I think I'm not entirely sure if like a lot of it is based on like not feeling comfortable, maybe just like a higher expectation of themselves, be like the fellowship is like a higher sort of where
Calling.
calling distinction or able to do a certain procedure.
So this, I didn't go into that slide. That's a great point. The ideal version of a fellowship is that this is something that really excites me. And I want to narrow my focus and I want to go deeper into one thing because I really like it, nephrology. I just love that kidney and I want to learn everything about the kidney. What we were trying to show, and the data shows, at least in our literature, then you should be able to practice, like if you're going to go into colorectal as a fellowship, then you should be able to operate for 30 minutes on your own. And so when we really look at the CVs and what happens to them when they go into fellowship, it's not like they're doing research. And it's not like they're getting really deep and going to societies, that a large portion of them are treating fellowships as transactional. It's just a couple more years. Now, maybe different in other specialties. I haven't studied it. I've only studied it in surgery, but we would expect that they would be equally capable at the beginning of their fellowship and only in it for interest. And if you actually talk to the residents, a lot of them are wanting to narrow their focus because it'll make them feel less uncomfortable. And here's the thing, you're always uncomfortable when you become an attending. I've never met an attending who wasn't uncomfortable. The question is, are you avoiding the discomfort of going into practice by going into a fellowship? And that's a question. What do you think?
I concur.
Some people are like, and it's more clear, and I know exactly what the expectation is, and I know exactly how to get a job as a cardiologist, which might be different than I graduated from internal medicine. Now what do I do? Well, you're a doctor. Go out and practice.
Dr.
Yeah.
Gillespie, can you hear us at Valleywise?
You can repeat it. I can hear you. Yeah.
Okay, you can hear us? Okay. Can you share with the residents something that you do or say when a learner does not want to interact with them? instead of getting angry, because that may be the first reaction, or this student doesn't want to be here, this learner doesn't want to do
Yeah.
this rotation, whatever it is. So what's something
That's-
you do or say that's specific?
Yeah, I'll talk about that in a minute. Thank you, Jessica. That's going to be the next portion. What do we do, right? Because do we agree this is a problem, or not a problem? Do we agree that this might be the current state of affairs, or have I missed something? That's the pushback I'm asking. Like, am I wrong?
Third year med student. I think a lot of the people in my generation are seeking to become comfortable with the uncomfortable, like you were describing, is a big issue. But I think that the thing that also we're like really not tolerant of compared to other generations is being mistreated in like a degrading way, or like, you know, just like mistreatment. And I think that a lot of the avoidance of the uncomfortable is because you're afraid you're going to be uncomfortable and mistreated at the same time. And I think that that is also a really huge problem to be able to level with the students from Gen Z.
Awesome. I definitely had a slide. I don't know if it's still on there. I pulled it off. Mistreatment is never tolerated. Okay, so here's where it gets a little confusing, and I may not have the terminology right, but I feel guilty because I hurt someone. I feel embarrassed because I'm in front of my peers and I said something that probably wasn't appropriate. I feel humble. I'm not as good as I think I should be, and I feel shamed, right? And shame gets really complicated, because is that an ugly feeling? Well, now it is. So let's just assume. And what does shame do? It makes me feel as a person, my dignity has been challenged, the dignity that's indelible in me and unique in me, and no one can take that dignity away. So if someone tries to shame you, they're mistreating you. So I'm going to assume somebody's not hitting you or stabbing you or like being overtly racist or sexist, because that's just never tolerated ideally in any generation. But then I've just been shamed by my attending. Well, now your dignity has been challenged and you've been deprived of your opportunity to learn. Not acceptable, right? So I should never shame you. The question is, do we sometimes commingle? I feel embarrassed. You should have known that. I told you that yesterday. You didn't bring it today. Did I shame you, mistreat you, or are you embarrassed or humiliated? Right? Humiliate is probably bad. I should never try to humiliate you, but maybe you feel humiliation. Okay, that's not a good feeling. That's a very uncomfortable feeling. And so what I'm wondering is there a little blurry line between feeling like I could have done better, or I should have done better, or I have disappointed my attending, and being shamed? Because shaming should never occur. We should never shame you. And that would be like, are you stupid? You should have known that. But you should have known that. Did I shame you or embarrass you? What do we need to do as educators? Not shame you, and be aware. We should have the emotional intelligence that if you take that as shame, you just shut down and you're not learning. Is that close to kind of what you're saying? Is that a way to look at it?
I think that gray line's a good point. I think it takes a lot of emotional intelligence and self-awareness to know when like you did not know something you were supposed to know, and they're just telling you that and they make you feel bad. That's not mistreatment. And I think that is something that our students my age should be educated on more, like how to work on, okay, I just got this feedback, like,
Yeah.
how do I handle that?
You may
But I
need to
have seen
repeat it for
examples.
Valley-wide so they can hear.
Oh, yeah. So one other thing, did you guys hear? So her question was, if she's a third year medical student, and what she said was, and we have a couple more slides, but this is great. Some of the reason the medical students might be avoidant and avoid uncomfortable situations is they're fearful of being mistreated. And mistreatment is shaming someone, meaning that you're attacking their personal dignity, And that deprives them of an opportunity to learn by saying you're like a bad person, you're incompetent, what's wrong with you as a human? As opposed to sometimes when we make mistakes, we feel embarrassed, we feel humble or humiliated, or we feel embarrassed. And so the question is, and it leads to what I was saying before, is that the terms, like maybe previous generations never thought of those 4 words. Now, the question is people can say, when I feel shame, I have been mistreated, and that deprives me and I'm going to avoid. But when you test somebody and you say, here's the situation, is the person feeling shame, embarrassment, humiliation, or whatever the other one was, they overwhelmingly will call it shaming when it really might have been embarrassment. And so they know the words and they're very well educated in the lexicon, but the application of have you been shamed or were you just embarrassed? But that requires emotional intelligence from the educator, because if I'm trying to educate you and you're feeling shame, I'm not doing a very good job of educating you. And so emotional intelligence and metacognition needs to be in both spaces, and the educator has to have it. The question is, does the educator have it? Well, that's why I'm here today, because you guys are the educators, resident as teachers. So be aware that it's okay for your students to be embarrassed. Just make sure that if they're feeling it as shame, you back off a little bit so that they can actually hear you. Okay, so what's the challenge for us? The challenge for us is to do what you just said. Create a curriculum that when you're not measuring up, there's accountability without actually the sense of shame. And so this will push them into developing grit and adaptability. Okay, so what is the Gen Z paradox? They want to drive change. They want the world to be a better place. They want to work in socially conscious spaces. Well, what is more socially conscious than medicine, right? So everybody who is in medical school or is a resident is driven for the positivity, and they want to make the world a better place, but at the same time they have to learn the road. So in the workplace, right, because we need workers. You guys aren't workers right now, even though you probably feel you are, as learners, or students are learners. What they've learned, direct feedback. And like, really, because the question is the safetyism being created by us? We are the educators, and we want to tell a student that they didn't perform well, but I don't want to shame them, and they may feel shame, to use your words. So I'm just not going to give them the feedback, because if I don't give them the feedback, they're not going to misunderstand. And what if I just give them a good grade, and on their evaluation, tell them they're doing good, and just keep feeding them? And how many of you have had an evaluation that says, you're doing great, you're awesome, just keep going, you've got a great personality, you're fun to be around? When you walk out of that feedback, do you feel like you got better? So it turns out Gen Z likes direct, straight up, I would have done it this way, this is how I want you to do it. And they want to be directed, and they want honesty. So we can be honest without, quote, shaming. And what we've learned is that they are used to structure in a way that maybe millennials and Xers didn't have, okay? And that means from us, they want clear expectations. And what I've learned is the clearer the expectation you give, the better, okay? And they are driving change, okay? So we know that they're interested in social impact. And here's the other thing they want from their leaders: transparency. They want absolute transparency, which doesn't mean that there are no boundaries. And that's hard, because if you want to be transparent, you want to share, you want to let them know that you get how they're feeling maybe, but you still have to have very, very clear boundaries, while at the same time you express yourself as fully human, okay? And what's important is we need to remind them that before you can have these more elevated conversations on how we're going to change the world, First, you need to learn the skills associated. If you're a surgeon, you have to learn how to tie a knot before you can change culture. Okay, we can change culture when we're learning to tie a knot, but we still have to learn the basics. We have to understand that there are structures and systems and policies in place, and that hierarchies do exist. And it's interesting to see that a lot of people don't understand that. And then what we need to do is let them know that they need to build trust in the workspace, and demonstrate their value and effectiveness before they can get into a room and say, we need to change things, okay? And the other thing is they may not understand the norms. And so I just think about, like, maybe on internal medicine, you're making rounds. Maybe they don't understand the norms, that when someone's talking, you don't pick up an iPhone and look at your iPhone while someone else is presenting. Like, where would they have learned that norm? And this is like a great example. I love this story. My daughter, I put her on a computer and she was so excited. She was like kicking her legs back and forth. And then she pulled the plug out of the wall and the computer went dead. And I'm like, Maria, don't you know you can't pull the plug out of the wall? And she's like, Daddy, is that one of those things you thought you taught me that you didn't teach me? And so what I'm thinking is, how do we know that they know what the norms are? How do we know that they know how to dress, how to present themselves, how to talk to people, how to be on rounds without being on their iPhone, how to like look at someone in the face? And this is what they're learning at work, okay? And that they need mentorship, we know this. And they need balanced leadership. Okay, so here's where I want to go. This looks like education. So what's happening in the workspace with what would be a fourth-year medical student would be someone who's 4 years out of college and not thriving in the workspace, living at home, serving at a restaurant when they got a degree in something that they should be working toward because their first 2 jobs didn't turn out. This is what they need: accountability, engagement, relationship building, creation of high expectations, and transparency. Okay, so what is accountability? This goes back to my first slide, that they are responsible for learning. You're responsible for giving them opportunities. You are also responsible for giving them expectations. You are also responsible for giving them feedback. Feedback in a way that doesn't shame, which means you must develop your emotional intelligence and your metacognition so that you can understand how they're feeling and how what you're saying is affecting them, and maybe change it a little bit. Help them understand the norms of the workspace by relationship building and being just transparent. If you make a mistake, I told you this, but I was wrong, they'll respect you more. Okay, so I really want to thank Dan Castellanos for this, because he said, well, Tom, you gave a great talk about how like teaching or how young students look at teachers as parents. Here's a book that really talks about maybe a very effective way of parenting. Have any of you read this book, The Gardener and the Carpenter? I love it. So I'm going to end with this on how I think we can really lean in. This is the leaning into Gen Z. So there's 2 methods of parenting a child. One is going to be, I'm going to start with the gardener approach. That's the Montessori approach, right? Whatever you do is good. I want to create an environment that's rich with opportunity, and you explore, and everything you do is magical. Okay, that's an exaggeration, but really it's a method of focusing on cultivating a rich environment that allows people to grow. And what you bring to that is support, flexibility, and allow them the opportunity to fail and explore and adapt. Okay, now the carpenter approach would be the traditional, like you've got 7 or time at 2, you're at school till 2, I pick you up, you have a power bar in the back seat, then you go to violin, then you go to language school, and then you do this, and then you do this, and then you do this. And it's a very prescriptive way of parenting, and think about a gardener, you create a nice garden, you plant the seeds, it grows. Whereas the carpenter, you have a blueprint and every nail is very prescribed for everything that you're going to do, right? So the carpenter approach is going to shape learner, and you're going to teach them specific skills with a training path, and success equals the competencies. You've succeeded in this competency. Here's the measure. This is why we know you did it. The Gardner approach is that organic growth, which values the individual thing that they bring that they're special at, and encourages them to go out into the world, get messy, mess up, right? And it builds autonomy, right? And if you're raising a child, you want them one day to launch. Well, guess what? We want every medical student to launch, and we want every resident to launch, right? And so it's the DNA, it's the competencies that we talk about, the 6 competencies, we're going to measure those, okay? And so the carpenter, this is what we need to do as educators. These are the carpenters, right? You need a blueprint. That's the curriculum. You need precision. That's skill mastery. I'm going to make you tie 100 knots. I'm going to make you do this over and over again until it's right. And you need to teach them the same thing over and over again, standard tools, reproducible. And then how do you know? Because you assess them and they have milestones, okay? And then this again is the DNA of residency, but the core competencies that you guys have in residencies, we use them in medical school. Now the gardener, right? This is where we create foundational knowledge. That's the soil, right? That's the soil. And then the water is the diverse experiences. You've seen 2 of these patients, now go see this patient. And the sunlight is you mentoring them. And then the pruning is the constructive feedback. So here's a fun one. I think this is what Jessica led into. And this is a real story. I had a medical student, and he came to me, he's like, Dr. Gillespie, I don't want to take trauma call anymore. He said, I have trouble staying awake. It makes me uncomfortable because the residents are really busy. They don't really pay attention to me. Nobody's really worried about how I'm feeling. And it's making me feel bad about myself. And by the way, I need my sleep hygiene. And it really messes me up for like 3 days. And I'm never going to take call. I'm never going to take call. So I don't see the value in making me take call in surgery in the trauma bay because I'm never going to do it. So what should I do? Should I accommodate them to support their wellness and personal educational needs? I mean, it was a good argument, right? It just doesn't work for me. Why do I have to do something that has no value to me? Do I tailor the learning experience to acknowledge who they are and create something that works for them? Be a gardener, right? Or do I be a carpenter? No, 24 hours. You have to take it. It's going to prepare you for things that you don't understand. And I need to create uniform education standards. So we don't have a lot of time to go into this discussion, but what would my answer be? We always know what the answer is, right? Something in between, a balanced approach. So I was going to give you one tool. You're talking to a student and you're going to give them feedback. Direct, honest, transparent, mindful of how they're taking it. If they're misunderstanding what you're saying and you can see the shame on their face, pull back. And then ask yourself, do they need a gardener or a carpenter right now? What am I going to be for them? And just be mindful. And one of the most important skills, and I got a minute so I can add, is dispositional mindfulness. Have you guys heard of that? It's a modifiable trait that protects doctors from burnout. And this is studied. And what it is just the statement, how am I feeling right now? What am I feeling? That's it. I am feeling frustrated talking to this student. I am feeling burnt out talking to this student. Talking to this student annoys me right now. I feel like they should know, and they don't. If you can name the emotion you're feeling and then speak to them. And ask yourself, how do I want to feel? Do I want to feel like a gardener right now, or do I want to feel like a carpenter? And then deliver the feedback with an expectation. Okay. Ideally, it's an expectation that is so clear that they can tell you whether they achieved it or not. Okay. And that's really my last words. I guess I could say one more thing. And sometimes they just need to F-A-F-O. Have you ever heard about that? F around and figure it out. So let them be uncomfortable and don't feel like you have to save them from everything that's painful. All right. Thank you very much.